Thank you so much for the introduction. Sorry for my voice. So I had the mission to put together the data that we have about demonstration and implementation studies. So I based my presentation on the dashboard created by AVAC and on the initial results presented at the last IAS and CROI conferences. So according to the AVAC dashboard, there are 45 ongoing or planned implementation studies using CAB-LA globally at this moment. Most of these studies are conducted in Eastern and Southern Africa, followed by North America. Studies are being conducted in several countries from different regions in the globe. Here we can see that most of the studies are enrolling cis women, but an important number of them are also enrolling key populations. 30% of the studies are planning to include more than 1,000 persons, and 60% less than 1,000 persons. So here, according to AVAC, there is one completed study, 30 ongoing studies, and 11 are planned to start. So I'm briefly talking about some studies conducted in Africa. The first one is the SEARCH study. So the SEARCH study is evaluating a dynamic choice HIV prevention intervention, includes CAB-LA as a PrEP option. So they found in this study a 56% difference in biomedical coverage in the intervention arm compared to the standard of care arm. And the standard of care did not include CAB-LA as an option. 56% chose CAB-LA among the PrEP options, and 43% using CAB-LA were PrEP naive. And in this study, there were no seroconversions in the intervention arm compared to 7 in the standard of care arm. Other two examples of studies conducted in Africa is one evaluating PrEP choice among transgender people in Uganda, and the mobile men study is focusing on men who are mobile for work in Uganda and South Africa. Another study is the Catalytic, who is providing local community engagement and PrEP choice for 11,000 people in 28 sites in 5 countries in Africa. The study supported by MSF is evaluating differentiated delivery model of including CAB-LA as PrEP option among different key populations in 4 countries. In Malawi, 3 studies are ongoing, including the Path to Scale for CAB that will include 10,000 persons in 36 sites. In Zimbabwe, one study is evaluating PrEP choice among cis women, and one study in Botswana is evaluating adherence and effectiveness of CAB immediately postpartum. In South Africa, the FAST PrEP is evaluating preferences by offering decentralized PrEP service through facility mobile clinic community model among 25,000 people. And the Let's Talk study will include 26,000 young persons in 40 clusters from a rural area and will evaluate social mobilization by peer navigators into community-based sexual health and HIV clinics. Now I'm going to talk a little about the studies from the United States and some results presented at CROI this year. So this study conducted in DC observed high initial retention rates, but a notable number of missed windows. Insurance medication coverage was considered a significant barrier for CAB implementation. The OPERA cohort included 101 clinics in 23 states in the US. Among 506 initiating CAB, 11% did not return for the second injection. And among those who had at least 2 injections, 69% had all injections on time. In a study from San Diego, discontinuation was higher among those of younger age with no medication assistance program and those who missed injection. In San Francisco, CAB-LA delivery using a low-barrier comprehensive care model provided high rates of retention and no seroconversion in a population under high social vulnerability. In the PILAR study, 220 cis MSM and trans men in 17 US sites were randomized to routine versus dynamic implementation. In this dynamic implementation includes telehealth strategies. And a large proportion of participants who were interviewed were satisfied and found telehealth delivery to be both easy and helpful for PrEP delivery. In the Ebony study is evaluating CAB delivery among Black, cis, and trans women in the US. So providers in the study reported high levels of appropriateness of CAB-LA for Black women. In Europe, 3 studies are being conducted among MSM. 2 are ongoing, one in Belgium and another one in Ukraine, and one in France is planned to start soon. Now Latin America. So in Latin America, we have 2 studies being conducted, both in Brazil. So the first one is the PrEP CAB Brazil study, which aims to generate critical evidence to inform national policies and program implementers about optimizing same-day delivery of CAB for sexual and gender minorities within the public health PrEP services. So during the formative phase, this study conducted process mapping, and the process mapping main challenges for same-day CAB-LA delivery were the duration of visits due to long time of the laboratory and HIV counseling steps. Community mobilization permitted the development of more inclusive and culturally appropriate HIV prevention materials and interventions. And in the focus groups discussions, WhatsApp messaging for appointment reminder and mHealth tool for PrEP choice were highly acceptable. The second study in Brazil is the study PrEP 1519 Choices, which will also provide information for the national policies. And it's been conducted in 3 Brazilian cities, recruiting sexual and gender minorities aged 15 to 19 years. And 10 other studies, according to AVEC dashboard, are planned among diverse population and regions, including studies in Australia, Thailand, and Vietnam. So in conclusion, early results show high acceptability of CAB-LA in multiple settings and populations. PrEP choice and person-centered decision-making can increase overall prevention coverage and effectiveness. Demand creation and community involvement are needed to increase CAB-LA awareness and uptake. Different PrEP delivery models, such as mobile units, pharmacies, and home delivery, are being evaluated in the studies. And most important, access to CAB-LA should be guaranteed to all populations in need, even after the end of these studies, especially in the Global South. Thanks to all my colleagues who collaborate for this presentation. Thank you, obrigado, danke schön.